For the last part of the IT laser, what I'm going to do is I'm going to focus a lot more on the origin insertion points. Hey guys, it's Nicole over here at Chiropractic. I'm here with Jordan today, and we're going to be doing some laser therapy on his IT band. Let's get started. All right, Jordan, are you ready?
Ready when you are.
Cool. Let's do it. All right, some beeps, and then I'm gonna get started. Just let me know if it gets too warm.
Will do.
And then kind of, yeah, perfect. All right. So Jordan has had some knee injuries. He does a lot of lifting, so his lower body gets kind of angry. So we're just giving him some treatment today and make him feel a little bit better for his shift later on in the day. Jordan, you do any squatting this weekend?
I certainly did.
You did?
Gotta take care of myself outside of that.
How is the knee doing today?
It's okay. It's been better.
IT band kind of tight today?
Yeah, very much so.
Well, hopefully that laser will go in and just knock some of that stuff out, bring some stem cell flow to that area, heal you up a little bit. Do you have any activities, any workouts that really irritate the lower body that you've been doing recently?
Yeah, a lot of compound exercises.
Compound exercises.
Compound exercises, your squats, your deadlifts. You know the like.
Got it. Got it. Meaty IT band Jordan's got here. So the IT band is kind of coming down and connecting up into this joint in here. And Jordan has some knee issues already, so it would explain the IT issue. So Jordan, what's the program for this week? Are you going to be beating this up anymore this week, or are you going to give it a rest?
Depends how I feel after this treatment.
Yeah, He's going to beat it up more. Don't let him lie. He's going to beat it up more and then come in the next day and ask me for treatment. Ain't that right?
Perhaps.
Yeah, So since this is a meatier and larger part of the body, this laser is going in with a longer session, more along the 5-minute mark. Just really getting in there, getting that energy in the muscle tissue, really going in and getting those healing processes sped up and started off really nicely so that Jordan can continue on squatting and making his muscles angry so that I can continue to treat them. Correct?
That's the deal.
For the last part of the IT laser, what I'm going to do is I'm going to focus a lot more on the origin insertion points, just because I know from treating Jordan that's probably where he's going to have the most irritation, especially because he does have some knee stuff going on already. You just had to jump on this video, huh, Jordan?
What's that?
You had to jump on this video because I'm leaving today. You're not going to have treatment later. Darn.
Had to get it in somehow, right?
Had to. It's all right, props. I give you props for that. That was good. Jordan has a bony knee, so getting his origin insertion down here is not fun. But it's okay. We'll do it anyway.
Keeping you on your toes a little bit, right?
Have to. Gotta keep me on my toes. That's how I become good at my job. Just 20 seconds. You can do it.
I don't think I can hold out for that long.
Just go ham on the rest of this for the last few. All right, Jordan, you survived. How's the IT band feel?
A lot better.
Good, it better. All right, well, that's all I have for you today, people. Go ahead and make sure you like and subscribe to our channel. Keep seeing wonderful content from us, and we will see you next time.